So welcome to the Embracing Neurodiversity. I'm Liz Howes. I'm one of the psychological therapists within the Bradford District Care Foundation Trust. What I'm wanting to do is invite you to and just share some of the work that we've been doing within the trust for our staff members. So neurodiversity refers to the variation in the human brain regarding sociability, learning, attention, mood, and other mental functions. Welcome everybody who's just come on. So here are just some of the examples of neurodiversity, and this is only just a few of them. So there's this dyspraxia, dyscalculia, the dysgraphia, and dyslexia, all but a few. Unfortunately, there are countless of neurodiverse individuals that still are quite reluctant to speak out about their challenges they face, and therefore they don't seek help when they need it. And this can impact negatively on their well-being and the longer term, and this may result in negative mental health problems in the future. So this can affect individuals in different ways, so that it can affect individuals with communication differences, sensory difficulties, thinking differences, and have an impact from any environment, social communication, and any other interaction. But it is really vital that we absolutely note here that there are no two neurodivergent people who are the same. And every person can vary, with traits being evident in some or not others. And it's unique to everybody. Everybody is human beings. If anybody does have any questions, my colleague is off sick at the moment today, so I am doing this myself. My colleague was going to chair the chat. So if anybody has any questions, please don't hesitate to pop your hand up. There'll be plenty of time to ask any questions, but please do. I'll put something in the chat and I'll try and manage that as well as doing this myself. So just a little bit of background, really. The inclusion and diversity is really important within our trust, and we really look out for people and support people within the trust as much as we can. So a little bit of background of myself. I am dyslexic, and I was diagnosed back in 2016, and the vision for this project that I started up for the trust was about thinking for other people, not just neurodiverse, but all staff members, to think differently about neurodiversity, which can allow people of all ages to reach their full potential. So what I did last year, I decided to start a much needed conversation about dyslexia across the trust. And I shared my own personal experience of dyslexia publicly in the Disability Month last year to the Executive Board and to other meetings across the trust. And this approach has enabled many of the staff members right across the trust to personally get in touch with me and ask what support that the trust was offering for neurodiverse employees. So that made me think that, for a start, I wasn't on my own, but it made me think about how we can support staff in other ways. So I started to establish a dyslexia and autism workshops, and these were aimed at raising awareness and support for individuals who were neurodiverse. So this was for managers to really think about how they can support their staff members, but it wasn't just about managers, it's about other work colleagues who could be mindful that somebody may be struggling within their team and how they can help and support them in different ways. And these workshops have really increased understanding of dyslexia and autism throughout the trust. We also, from that, we also set up the neurodiverse peer support groups that have also been set up to provide confidential support, safe place for people to discuss and meet up with issues that may be affecting them. They share tips and ideas and be open about challenges and concerns that they may have. And the peer support groups are also there to empower individuals, enabling them to value their uniqueness and individuality. And it's also allows staff freedom to speak out about their struggles and offer support in a psychologically safe space. That's never been more important. Within those peer support groups, if there is anything that there is that we feel as though that the trust can do differently, and there's still lots and lots of work to do to make the trust more neurodiverse friendly, but we are doing a lot of good work there. So the exec team have actually set up a neurodiverse task and finish group, and we meet once a month. And if anybody who from these peer support groups would like me to take any concerns there, please let me know and I will take it further just to see what we can put in place. Sorry, I've got a on chat of the peer support groups. Let me just check this. Are the peer support groups the same as staff networks? No, they're different. So the peer support groups are, I run I run three. So I run a neurodiverse one, which is anybody who is neurodiverse can come and they support one another. And I run two autism peer support groups. One of them is specifically for autistic staff. They felt as though it was important they gain support from like-minded people who were autistic. And I also set up one for staff members who are carers for autistic family members. And that is working really well as well, because a lot of people don't know where to go to, and sometimes they just want to offload and they share tips as well. We do have a network, staff network, May, and this staff work is called the Beacon Network, and that is for anybody, whether they have a hidden disability or a physical health problem. That is a massive network. We have about, well, I think it's about over 100 staff that go to our Beacon network once a month. They've been absolutely fantastic in supporting people. We have all had an input on developing the disability policy. We have outside speakers coming in, and we are there to help and support each and every one of us. And it is strictly confidential. What I would like to do is just invite you to a scenario, which is the day in the life of, and it's just a little story about a little 8-year-old girl. So if I could just invite you just to sit back and just close your eyes. What I'd like to invite you to do is bring up an image of an 8-year-old girl. She's sitting round a table full of adults where everyone's talking over one another. The little girl tries to listen intently so she understands what the facilitator is saying. and she writes down what she can hear as there's lots of information to take in. Can you see her? The facilitator looks over to her and asks her to read out some work she has done. The anxiety starts as she fears that she won't be good enough. As she reads out her work, she looks up and she sees other people laughing. Can you see her? The facilitator looks at her watch and says, "We don't have much time left." So the little girl tries to read faster, but the letters are mixing up. Can you see her? Her confidence is low. She starts to withdraw from others in the group, and she tries to avoid situations as she fears of looking foolish. Can you see her? But I now invite you to open your eyes. This 8-year-old girl was me in a team meeting as I struggled to keep up before I got diagnosed with dyslexia. I have a reading age of an 8-year-old. I can't keep hold of information, so I do have to write things down. So when people are talking to me, sometimes when there's lots of new information, I cannot digest that all at once. Sometimes it's evident, sometimes it's not. Sometimes I find it hard and I have to reread emails. Sometimes it takes me a long time to digest different new information, but I get there. Thinking about my own experience and the struggles that I had before I found out I was dyslexic and continuing afterwards, I thought about how I could help and support other people who may be struggling, maybe with written information, or by just some hints and tips that I've developed over time that I could help and share with other people. A big struggle of mine was looking at where all the different links were within our trust. SharePoint, ESR was a big thing for me, and I didn't know how I could get to a link to try and find different things. So what I wanted to do is just to develop a resource booklet. So this resource booklet is basically a bubble of support. And I do like this quote which starts the booklet, where it says, "Small changes that can easily be made to accommodate neurodiversity really do add up and can transform a person's experience. And it really can make a difference. Just a little part of change can make a big difference." So the considerations could, for different backgrounds for a start, I don't know if you're mindful that these backgrounds on these presentation slides are blue. It's pastel colours are a lot better for words to stand out rather than white. Everybody, again, like I said right at the beginning, everybody's different. So the pastel colours could change for individual people. So I was mindful that blue is quite a very pastel shade, and a lot of people have given me feedback within the trust who are neurodiverse that maybe possibly a best colour for individuals. This work booklet has different accessibility things, examples of how to access PDFs, Word documents, spreadsheets, leaflets, and how to make that more neurodiverse friendly if somebody is developing work documents or leaflets or posters in the future, just to be mindful that there are neurodiverse staff members out there or service users that could really function better with this. I'll give you an example of what we have done in the trust. There was a neurodiverse staff member highlighted that the fire safety posters were not neurodiverse friendly. So we have been in touch with the fire safety team, and they've changed it very slightly just to be more neurodiverse, and that can make a massive difference for staff members for their health and safety, just by actually reading out where they have to go. It can also allow for the use of text to speech and to facilitate ease of reading. So in this workbook, it shows you how you can do that. And adopting best practice for readers have the advantage of making all this written communication easier for the eye. Does anybody have any questions on that? No?
I was just wondering whether this resource booklet available outside of the trust, or is it just
it is available outside the trust, but what I have done, I've developed this for our trust staff members, but I have developed one for outside the trust as well. If anybody would like a copy of the resource booklet, can you please just send your email address, put it in the chat, and I'll get back to you and I'll send you all the details, if that's okay. My colleague was going to manage all that, but you know, if anybody who's interested in this, please just write your email address and I'll email you directly about it.
Thank you.
My pleasure. Accessibility visual support. This is, again, it gives you resources on how to change the background colours in Windows. You know, keyboard shortcuts, which I have found absolutely fantastic. They're very easy if you know them, but it's very hard if you don't. Change the colour of the paper. Read out loud allows you to listen to the text as well and dictate. And Outlook shortcuts. There's a lot of lovely hints and tips on how there are key shortcuts in there. And anybody could just have this to hand. So this resource booklet would be really good, not just for staff members, but you could use it for family members, just to help them. Children who are maybe neurodiverse, could help them with the schoolwork if they have to do homework and things like that. The bubble of support. Our staff support and therapy service that I work in, we also offer one-to-one help and support to anybody who is neurodiverse, or any staff members who are struggling with their mental health, with maybe stress or anxiety. You know, we can offer them workshops, we can offer them one-to-one brief therapy as well. In this booklet as well, there's the regional and national wellbeing support networks. And again, our Beacon network, you know, that is a fantastic resource for anybody. So we do have a lot of support across the trust for neurodiverse staff members and people with hidden disabilities. The bubble of support, we further SharePoint resources. So in this resource booklet within the trust, there is very, very easy access to our coaching and mentoring, our carer support network, the freedom to speak up, human resources, unions, the disability and reasonable adjustments, and other useful websites like Access to Work and ACAS. So in that resource booklet, people can just go straight into it and just click straight onto the link, and it will take you straight to these places. And this is one big thing about my struggles, and I hope it helps other people as well. And that's trying to find these resources in SharePoint. It was a little bit confusing for me with my dyslexia. Does anybody have any questions? Let me just check the chat. I will send everybody emails as soon as we've finished this, so don't worry with everything, and I'll send you the copy and the details of how you can get this as well. If there is any questions, or you know, you can contact me direct, and I will send you let me just send you my email address. So any questions whatsoever. There you go. So that's my email address at work. Any questions or anything, please don't hesitate just to email me. And I've just got a few hands up. May.
I was just thinking that I was onboarded back to the NHS a year ago, and it was really, really confusing because lots of things have gone onto electronic.
Yeah.
And the staff website. I don't work for Bradford. I'm work in a trust in London, but I'm autistic, and probably have ADHD as well. And I was just thinking that, like, I don't know about neurotypical people, but I was just thinking that something like this, with all the links for onboarding in one document, would probably have been useful to all staff as well.
Definitely.
So I don't know whether, like, you know, there's an opportunity here as well. Anyway, yeah, I'll leave it there.
Thank you, May. And this has gone out to all. Ours has gone right out to all staff members. But I think it's really important that people can not just have it, but just actually use it. You know, a lot of people have documents and they just file it away and forget about it.
Yeah.
What I'm actually I'm in talks with IT at the moment to see if they can put like a self-help folder on everyone's desktops, which has a lot of useful neurodiverse guides in there and resources in there, and this will be one of them. But we are still in talks with that, and I think it'd be really handy just for anybody just to click on the desktop, click onto that folder, and it's there. So that's what we are actually looking into doing, rather than just having this as an electronic document as well. So someone else has got their hand up. Let me just check. Kate.
Oh, thank you. It might be too early to answer this question, but I was wondering about, because some of this is there's resources and the kind of people thinking, actually, I need to make what I'm doing accessible, and need to think about backgrounds and fonts and just about who's going to look at it and who's going to make sense of things. I suppose I wondered how that was going, or whether you've got any advice for us, the local authority and other partners. And I just really feel for, it's a bit, I suppose I was thinking it's a bit like in schools with Senkos. Actually, if you have good practice in terms of neurodiversity friendly classrooms, then actually that makes them a welcome places for all children, doesn't it? And I just really feel for you that it is when in your working life that you were diagnosed, and that those missed opportunities before then. That was all, really.
Oh, thank you, Kate. The thing is with myself, I didn't know anything different. I always struggled at school, and you just get on with it. I struggled at school. I got my degree. I got a first in my degree, and I didn't even get any help because I thought it was the norm for me. And it was only until I got a different position within the trust. I've been in the trust 18 years. And within the trust, I got a new position, and I had to do many, many different reports. And it was only then when my manager picked up and saying, "You seem to be struggling," and and that's when I got that diagnosis. It doesn't make a difference if it's a diagnosis or not. I'm still me, and I still have my struggles. So this was developed on the back of, if I'm struggling with this, then maybe other people may be as well.
Well, thank you, and thank you for putting that into some, and converting it into something really helpful for all of us, that even if that's not our experience, how we can think about what we do and how accessible and friendly and just make sure we're helping each other. I think it's brilliant.
Yeah, thank you, Kate. And this is for everybody. It is for every single person can make some use of it, whether you're not neurodiverse, but it's thinking about developing things that could be actually, help and support people. Just that coloured background can make a massive difference, because it can bring out those letters rather than people struggling on a white background. We are looking at changing policies. There are filters that people can put onto their screens, and it's all in this work booklet, that people can do. There's IT can do lots of things. If you are neurodiverse, speak to IT. They can put lots of things in place. So we recognise that, Bo, you've got your hand up. Hi, Bo.
Hi there, and really fantastic presentation. Thank you very much. And I've witnessed the good work that Liz has been doing in the trust as I work there too. So thank you. I just thought it'd be interesting to just explore with you around this diagnosis, sort of the process, because people don't always know what the process might look like. So you said that your manager saw you were struggling. Does that mean then occupational health and then work paid for you to have a diagnosis?
That's right. Yeah, my manager, she reached out and she said, would she like me to be referred? So she referred me to OcuHealth. It was just a quick phone call, and they referred me to a place called, I think it was something Actions in Leeds. It did take a while. And I think there is quite a long waiting list because of the COVID, but this was back in 2016. But I saw a psychologist, and they sent a report back to me and to the employer with the struggles I'm having and the recommendations that they put in place. Those recommendations also was there for anybody where they can get the equipment, order the equipment from. So they can go through, order it, and access. They can claim the money or most of the money back from access to work.
Right, I see. Yeah.
So if there's any equipment like Dragon or the read and write or the mapping, you know, the trust can get money back from that.
Yeah. Because I'm just conscious that there are people struggling that don't have a diagnosis, and then it can be harder to you know, organisations like that evidence, and then it's harder to get that support.
Yeah.
Unless you're referred. Do you see what I mean? Or you go through your own routes. So
yeah.
okay.
Yeah, that's only my experience, Bo, because that was back in 2016. But access to work is really good, and in this booklet, resource booklet, there's all the details of access to work, so people can phone them up as well direct.
Sure. Thank you, Liz.
My pleasure. Nice to see you, Bo.
And you.
So we recognise that although work is an important part of wellness, it can also bring difficult situations and numerous personal stresses that can compromise our mental health and well-being. And it's therefore vital that taking good care of our workforce isn't just about offering individuals benefits. It's about taking a completely different viewpoint and trying to understand and meet the needs of our neurodiverse employees. And I'm really proud of what we have as a trust achieved so far, you know, building those solid foundations to ensure that our workplace is inclusive around neurodiversity. I'd be interested for any feedback on the copy of this resource booklet. If I could, you know, if anybody's interested in having one of these, I will send an email back, and I'll give you, you know, a few days to have a look through it, and if at all possible, if you wouldn't mind, I'll send you another email just to get some feedback on the booklet, because we can only develop it better if we get that positive, you know, or negative feedback. So any feedback, I'm not going to take any offence. We are a big team, aren't we? The NHS, it doesn't matter what trust we are from within the country. If we can help and support one another, then that'd be really good. Any other questions? We've gone through this pretty quick, so if anybody has any questions for me or anybody would like to share anything. Thank you, May. That'd be really good. May, you've got your hand up.
So I put a question in the chat, but I also want to respond to something that's in the chat. If that would be okay.
Of course. I apologise if I've missed that.
No, like it's like the chat's going pretty quick at the moment. And yeah, I'm not standing up there talking and trying to focus on like 3 things at once. Somebody was saying that they've got a Surface Pro, which I think is a Microsoft product, and I have been in touch with the Microsoft team several times in terms of, because I have a friend who is blind, so we've been trying to look at adapting her laptop for her needs, and things that like Zoom doesn't really work for her because the closed captions, which we need for somebody else in our group who's hard of hearing, so their needs clash when we're having a Zoom meeting and just things like that. Anyway, Microsoft have been really, really helpful. So I'm trying to dig out the email, but if I don't manage to do that before the end of the meeting, then I suggest actually looking and get in touch with them, because they really value the feedback. But then again, if it's because you're using an external program like Dragon or on your laptop, then I'm not sure whether Dragon might be the most appropriate software company to contact.
Mm-hmm.
And then I wanted to ask, if it's okay, Elizabeth, I work in this trust in London, and it's an external contractor, and they've been pants even just for normal onboarding, and they've been like less than responsive to like anybody's needs really, apart from a password change. Is your trust, do they have an in-house IT service? How did you find liaising with them?
Our IT service is fantastic. With us developing the new task and finish support group, we have individuals from IT, from human resources, from comms, or from all different services to come together to see how we can develop the trust more neurodiverse friendly. And IT are really on board with getting some mentors in, maybe just for people to be there for individuals who are neurodiverse. So they are looking at doing some training on different systems and how they can help and support neurodiverse staff members. Sometimes, life is very fast, isn't it? In the NHS, I think that's their middle name, is change, and the fastness of the pace of how things do go on within the NHS. And sometimes when people pick the phone up to IT, then they may have a queue of different calls. But just to slow things down and just to have somebody to be there and just not rush the call, that will help massively for somebody who's neurodiverse and who's struggling. They may need some instructions, they may need to be led and offered one-to-one support rather than being just sent some instructions, on paper. So, our IT are really supportive. The trust is really supportive. We are really open to help and support neurodiverse staff members. I've been in the trust 18 years, and I don't want to I can't say anything more highly of them, really. There are lots of changes we need to do, but we're starting and we're listening, which is the most important thing. Has that answered your question, May?
Yes, it has. I mean, you sound like, your trust sounds like a really supportive employer, and I think this whole showcase has been great. The whole festival has been great in sort of showcasing best practice and, creative initiatives. And I kind of feel like it's inspiring, but I also feel like it's a stark contrast to what I'm battling at the moment. Mm-hmm. So, but thank you very much. That's,
Again, May, you've got my email address. If you need any support, please contact me.
Thank you so much.
Bo?
Hi there. I suppose I just want to respond to May, because it sounds like it's been easy in our trust, but actually it's been down to the disability network, and that's known as the Beacon Network in our organisation, and also the Neurodiversity group that have been really pushing this agenda. I think without their efforts, May, that we wouldn't have got to the point where we are now. That they've really, been in touch with the head of IT, asking him about neurodiversity. So I think it's been their resilience and their willingness to not let it go, really, that has brought us to this point thus far. So that, and just thinking about how that happened, that was a collective voice, really. So there's a number of people that are neurodiverse in our organisation. And I think it started really the discussion in the disability network, and then it went over to sort of the neurodiverse group of people that were really struggling, I think. And one of the things that I became aware of that was a real struggle was they have something called Convene, which is a system that you use for arranging meetings. These are board meetings and putting all the papers on there. And there became a realization that a lot of people were struggling with this system, especially our neurodiverse colleagues. You know, this system had been implemented without any sort of feedback around how others might use it or what. So it really identified that there needs to be some sort of you know, input from the beginning from those that are using these systems. But it has been fantastic what the neurodiversity and the disability network, Beacon Network, has done in our organisation to push forward this agenda, make it mainstream. Thanks.
Thank you, Bo. Any other further questions?
I think there's another hand up.
May?
Oh, it's May. Hi, May.
Sorry.
Were you wanting to come in again, May?
I wasn't, but I can think of something else. Something just occurred to me in terms of what you were saying about computer systems. So I come from I've been an OT for 13 years, but I've worked in law and insurance and computers before all of that. And I was just thinking that in terms of website design and app design, sort of like getting user input right from the beginning and designing it around the user experience is normally like first principles. And it's just, I find it mind-boggling that trusts don't think along those lines. But then I guess that's the computer companies flogging their product to the trust, and they're not being consideration for the way, like other ways that people think and other ways that people use and interact with the screen. And yeah, anyway, I'll leave it there.
Just to say, May, that there should be that interaction. You are quite right there. And in our trust, we've looked at an equality impact assessment. So, you know, equality should be built in from the very beginning. And so we've looked at we've developed an equality impact assessment for strategy, policy, and really big decisions in our trust, that we're hoping to roll that out to get people to do these equality impact assessments, and hopefully we'll be able to look at what the impact is across the board with regards to, you know, the thinking right from the beginning around implementation of strategies, policies, or systems.
Thank you, Bo. Any other reflections? Any questions? Any queries? Sonia?
Hiya there. Thank you, Liz, and thank you, Bo and May, and everyone who's shared. This is absolutely fantastic. It is brilliant. So I look forward to sort of sharing the resources with that Enable Staff Equality Network here at BTHFT. and sort of cascading this further far and wide. I think it's your presentation has been absolutely amazing. You know, I think this festival has given a real sense of collective hope to a lot of people. We've at the trust, I've been quite crucial in sort of delivering some of the sessions as well here, and that whole thing of them. So I've got a bit of a cough and a cold, so I do apologise. And I've got a heater in the background. My heater and my boiler's gone off, so if it's a bit of a noise in the background, it's my electric heater on. But I think the feedback we've got so far is that this whole thing of bringing, like yourself here, Liz, and just speaking from your own lived experiences, this is the power of it. It resonates very strongly with our colleagues and people far and wide from the trust, not trust-based, in the community, across other organisations, and this is what will make real, effective, meaningful, authentic, impactful change, I feel, and especially in terms of neurodiversity. I think it's brilliant, so thank you. And I think just going on to sort of looking at some of the comments made around some IT and IT interaction and making things more sort of accessible, it's actually we're implementing, just yesterday we had our Equality Diversity Council meeting, where in the draft version of with our head of EDI, Kesey Art, is writing our EDI strategy, and we're looking to just remodel, revamp all of that to have a version that could even be as simple as a plan on a page, and it to be more versatile and to work with the IT systems people to make things to look outside, to think outside the box really, on how we present and how we can engage and interact with our diverse workforce across the trust. So these conversations are relevant, they're important, and I think it's just great coming together. This week has been very inspirational on so many levels, not just as myself in the role that I do, but on a personal level. So I just wanted to say a massive thank you, and thank you, Bo, for sharing, and thank you, May, for it's been great having you, seeing in and out of some of the other sessions as well, and really engaging with you. It's been great. So thank you very much. Thanks.
Oh, thank you, Sonia, and yours was great as well. That I came to. But it, like you said, communication is massive. You know, it is really just one part of things that we have changed within the trust is the inductions for new starters. We have put something in our induction pack about neurodiversity and all the support that the trust offers for those individuals, where they can go and what they can do. You know, looking, I think I went on somebody else's, I think it was Wednesday's workshop, the presentation, where they were discussing about how the impact of job interviews can really impact on the individual, giving them, so we've also done that. We have also actually put something in the job descriptions, you know, about neurodiversity. So it's just little things, little changes make a massive difference to individuals. We want people to come into our trust and saying, we will support you, you know, in any way that we can possible. And just for people feeling more welcome and knowing that support's there can make a difference. People, staff, retention, staying in the trust or leaving. Anybody else? Any comments? Any suggestions? Well, thank you everybody for coming on a Friday afternoon. I hope it's helped in some way, and I will be responding to everybody individually who has commented in the chat.